Hi, I'm Dr. Sheila, and I am the Pelvic Coach. I would like to talk to you today about the question I get a lot. I like to answer all these questions that people kind of throw at me as I am out and about. But an interesting question that I had was just why do I get bladder leaks? Which I thought, hey, that's actually a pretty good question. There are so many reasons, though, that you can have a bladder leak. I know the first thought is, oh my goodness, I must have a weak pelvic floor. But it might be part of the question. The reason, it might actually be the only reason, we don't know. But I just want everyone to be aware that there are more reasons than that as to why you might have a bladder leak. And I'm talking about bladder leaks that are more regular, not the one that just every once in a while when you laugh or cough, you have a few drops come out. That's not normal, of course, and it shouldn't happen. However, if you happen to have a full bladder, I'm kind of one of those coaches who, if you have a full bladder, if it happens once or twice a year, you're probably fine. If it happens more often, though, say, for example, every time, or even if you're exercising, lifting something off the floor, those kind of things, and you notice that you really cannot control your bladder leakage, then that's when it will be good to kind of get a little bit of help or get a little bit of guidance, because I'm telling you, sometimes it might just be just a little tweak and your problem will resolve or certainly get better. So you don't want to live with bladder leaks if there's something that can be done. Why would you do that? Really, why? So let's talk about, though, a couple of reasons why you might have bladder leakage. And of course, I'll talk about the one that everybody thinks is the most common, and that is that you have a weak pelvic floor. Now, if you have a weak pelvic floor, you may or may not have bladder leaks. If it's very weak, yes, you will. But just as there's a degree of weakness with all the muscles in our body, or a degree of strength, same thing. If you have just a little bit of weakness of your pelvic floor, that does not necessarily translate into you having a bladder leak. However, pelvic floor weakness is one of the main issues that I have seen throughout the years. But another one is actually having a tight pelvic floor. So, and this happens a lot. You can feel pressure, pain. You can feel that it's difficult maybe to have your flow of urine come out without straining. A lot of times all of those will be indicators that your pelvic floor is not as relaxed as it could be. And there can be many reasons for that. I'm going to talk about that on one of the other videos that I'm going to do. But there can be several reasons why that actually can happen. So pelvic floor weakness or pelvic floor tightness, both of them can cause urinary incontinence or bladder leaks. Another one is if you're heavy. So being overweight or obese puts pressure on your bladder. A lot of women hold their weight in that region. So even as you age too, it's a little bit harder to get rid of abdominal fat. So abdominal fat, it will push down. Gravity pushes everything down. You're standing up, gravity is going to push that fat down towards the floor, which is where your bladder, your pelvic organs are. And that being the case, that pressure could actually increase your chances of having a bladder leak. Right? If you are pregnant, hopefully your bladder leak will go away once you heal. So the reason why you want to seek help if you still have a bladder leak after you have had your baby is if it has lasted a couple of months, because it does take a couple of months to heal. And delivery, especially vaginal deliveries, can I don't want to say be traumatic, but they stretch the tissues and they change the tissue configuration for a bit until it goes back to where it was after you've had time to heal. So those are some of the main reasons. I do want to say, because I do like to keep these talks really short, but also bladder irritants. So there are foods that you might consume that your bladder doesn't like. And that's kind of a trial and error, and it's actually keeping track of your symptoms. And they have bladder diaries that you can download actually off of the internet and fill those out and perhaps see your patterns. So I do hope that those little reasons that I just gave you help. And then as we go along, I'm going to talk about each one and a little bit more in depth. And then what can you do about it? Because you really need to know what to do about them. But until next time, I want to thank you so much for listening. I hope that you got some information out of this. And if you did, of course, comment and click and subscribe to that button on that button below. Until next time, you all have a great day. Thanks. Bye-bye.